Common side effect of iron supplements is constipation, diarrhea, vomiting, rash. Correct answer is option A, constipation. Which injection is given intradermally? Rabies, hepatitis B, tetanus, BCG. Correct answer is option D, BCG. The main symptom of asthma is productive cough, chest pain, wheezing, hemoptysis. Correct answer is option C, wheezing. What is the first aid for a chemical burn to the eye? Irrigate with water, use antibiotic drops, cover eye tightly, apply eye patch. Correct answer is option A, irrigate with water. A patient with severe burns is at greatest risk for fever, fluid loss, increased immunity, hyperglycemia. Correct answer is option B, fluid loss. Which of the following is an inactivated vaccine? BCG, OPV, IPV, MMR. Correct answer is option C, IPV. Which stage of pressure ulcer shows exposed bone or muscle? Stage 1, Stage 2, Stage 3, Stage 4. Correct answer is option D, Stage 4. Which electrolyte is essential for neuromuscular activity? Sodium, potassium, chloride, iron. Correct answer is option B, potassium. What is the normal range of respiratory rate in a newborn? 15 to 20, 20 to 30, 30 to 60, 70 to 90. Correct answer is option C, 30 to 60. The first heart sound S1 is caused by closure of aortic and pulmonary valves, mitral and tricuspid valves, tricuspid and aortic valves, pulmonary and mitral valves. Correct answer is option B, mitral and tricuspid valves. Which is a cardinal sign of inflammation? Cyanosis, rash, failure, edema. Correct answer is option D, edema. Which of the following is a feature of right-sided heart failure? Peripheral edema, crackles in lungs, pulmonary edema, dyspnea. Correct answer is option A, peripheral edema. Which pulse site is used during adult CPR? Radial, carotid, brachial, femoral. Correct answer is option B, carotid. What is the recommended angle for an intramuscular injection? 15 degrees, 45 degrees, 90 degrees, 120 degrees. Correct answer is option C, 90 degrees. Which nursing action prevents deep vein thrombosis in bedridden patients? Low protein diet, massage legs frequently, encourage early ambulation, maintain bed in Trendelenburg position. Correct answer is option C, encourage early ambulation. Which lab test is used to monitor anticoagulant therapy warfarin? INR, AFTT, platelet count, bleeding time. Correct answer is option A, INR. What is the medical term for nosebleed? Hemoptysis, hematuria, epistaxis, none of these. Correct answer is option C, epistaxis. Which is a common complication of IV therapy? Bronchospasm, phlebitis, pneumonia, bradycardia. Correct answer is option B, phlebitis. What is the normal capillary refill time? Less than 2 seconds, less than 5 seconds, 5 to 10 seconds, more than 10 seconds. Correct answer is option A, less than 2 seconds. Most effective way to prevent infection in hospitals is use PPE, antibiotics, hand hygiene, isolation. Correct answer is option C, hand hygiene. The most common complication of a fracture is hypertension, pneumonia, hemorrhage, infection. Correct answer is option D, infection. Which electrolyte imbalance can cause cardiac arrest? Hyperkalemia, hypocalcemia, hypoglycemia, hypernatremia. Correct answer is option A, hyperkalemia. In Erikson's theory, the developmental task of adolescence is trust versus mistrust, industry versus inferiority, autonomy versus shame, identity versus role confusion. Correct answer is option D, identity versus role confusion. What is used to measure intraocular pressure? Thermometer, sphygmomanometer, tonometer, otoscope. Correct answer is option C, tonometer. Which of the following is an antipyretic drug? Diazepam, paracetamol, aspirin, both B and C. Correct answer is option D, paracetamol and aspirin. What does PPE stand for in nursing? Fashion protection equipment, personal protective equipment, pathogen protection environment, preventive physical equipment. Correct answer is option B, personal protective equipment. Hepatitis A spreads primarily through blood, airborne, fecal oral route, sexual contact. Correct answer is option C, fecal oral route. Which condition is characterized by low platelet count? Leukemia, polycythemia, anemia, thrombocytopenia. Correct answer is option D, thrombocytopenia. Which hormone regulates sodium and water balance? ADH, insulin, estrogen, thyroxine. Correct answer is option A, ADH. The apical pulse is best auscultated at second intercostal space, right sternal border, fifth intercostal space, mid-clavicular line, fourth intercostal space, left sternal border, third intercostal space, mid-axillary line. Correct answer is option B, fifth intercostal space, mid-clavicular line. Thanks for watching. Subscribe to the channel for the latest informative MCQs.